Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh Al-Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today. We are still in the series of epidemiology. Today, we will clarify and discuss with examples of epidemiological purposes, epidemiological perspective and usage. Epidemiological purposes. Whether epidemiological studies are aimed, where possible, at relieving unbiased relationships between exposures such as any biological agent, bacteria, viruses, fungi, rickettsia, prions, or alcohols or smoking, also exposure to stresses or exposures to chemicals and radiations with mortality or morbidity rate in any population. The identification of causal relationships between these exposures and outcomes is an important purpose and aspect of epidemiology. The first purpose of epidemiology is to find out the agent, host, and environmental factors that affect the health of population, as epidemiology is the method used to find the causes of health outcomes and diseases in population. In epidemiology, the patient is all the community and individuals are viewed collectively. In this example, the agent here is Babesia bovis, which showed as Babesia bovis inside the RPCs, and the host is the cattle, while environmental factors that help this agent to enter and cause a disease in this host are free or endemic areas, where if this tick coming to a free area, then acute signs of babesiosis with several deaths in a cattle herd will be reported. Also, unhygienic conditions. Presence of this tick in a farm of cattle or in an individual cattle is due to unhygienic conditions, as the owners of the farm or the owner of this cattle did not get rid of this tick. Also, transmission ways. These Babesia bovis are transmitted through this tick for 5 generations by trans-ovarian between generation of these ticks. So, entrance of Babesia bovis in any herd with presence of ticks that take blood meals from these infected cattle will make the babesiosis in this farm extended for decades unless we get rid of the causative agent by get rid of the transmission tick. Presence of ticks is the great and the main way to transmit the Babesia bovis from infected farm or infected cattle post taking blood meal to an health cattle to cause babesiosis. So, agent, host, and environmental factor are one of the purposes of studying the epidemiology of babesiosis in any cattle herd. Second purpose of the epidemiology is to locate the relative importance of causes of diseases and illness, disabilities, and deaths within the community. Epidemiology is not just studying the health in a population, but it also involves in application of knowledge gained by different studies to control different diseases and health problems. So, assessing the community health, either this community is animal populations or human populations. Public health and infectious diseases officially responsible for policy development, implementation, and evaluation, as well as control. The usage of epidemiological information as a factual framework for decision making. To assess the health of population or community, relevant sources of data must be identified and analyzed by a person, place, and type as a descriptive epidemiology. What the actual and potential health problems in the community occur, where they occurring, which populations are increased risk, which problems have declined over a time, which one are increasing or have the potential to increase, how these patterns related to the level and distribution of public health service available. More detailed data may needed to be collected and analyzed to determine whether health services as a human health services or veterinarian health services are available, accessible, effective, and efficient. This example clarifying the relative importance of causes: free areas, endemic areas, infected workers, young ages, ease transmission due to unhygienic condition, using of contaminated equipment, and etc. of unhygienic conditions will be act as a source of transmission of tuberculosis. So, what are the actual and potential health problems in the community we discuss is the tuberculosis. Where are they occurring? This disease could be occurred in free areas due to introduction of infected animal, in endemic areas after reopening of sequestrum in infected animal, infected workers which transmitted the tubercle bacilli to a farm or to the neighbors. Young ages are more susceptible to take the disease, which then appear of the chronic stages after 2 years in case of animals. Is transmission due to unhygienic condition of these workers using, as well as uses of contaminated equipment. Which population are at risk with increase of this is the animals in free areas or animals getted husbandries with infected workers, as well as introduction of newly purchased animal from endemic area to these areas. Which problem have declined over the time? This problem will be declined over the time by using of test and slaughter. Which ones are increasing or having the potential to increase the newly born animals from infected dams or due to they are take the infection from another dams. How do these patterns relate to the level and distribution of public health service available? These patterns relate to the level and distribution of public health service and the veterinary health service available by testing of these animals and testing of the infected workers or the whole workers in this farm. We said in tuberculosis, working in tuberculosis farm is more dangerous than working in tuberculosis hospital. This disease will cause disability by slaughtering the animals, or the animals become clinically diseased with wooden cows in the farms post 2 years old. This will be high due to test and slaughter, and at the end this disease will appear and reappear for decades in this population. So we use the latter information for decision whether this farm be continued or destructed completely and rebuilt. Third purpose of epidemiology is to recognize the segments of the population that have the greatest risk for a specific cause of illness. An example of this segment of the population in the epidemic of SARS-CoV-2, peoples over 60 years age, immune-compromised persons with chronic disease, health workers are the segment of the population at more risk for illness by this disease. The disability and deaths of these segments are 50% of the total population. Today is 7th of May 2020. The governor of New York City in the day before said that they are found 66 of elder people. That segment above 60 years age which live in closed houses are died due to SARS-CoV-2. So epidemiology discuss the segments of the population which are risk. Epidemiology is used daily for making individual decisions, but somewhat the society peoples are not aware by this. We will give examples. Many individuals may not realize that they are using epidemiological information to make daily decisions affecting their health. When persons decide to quit smoking, climb the stairs rather than the weight of an elevator, eat a salad rather than a cheeseburger with fries for lunch, or using a condom, they may be influenced consequentially or unconsequentially by epidemiologists for assessment the risk that may be contact with their health. Since World War II, epidemiologists have provided information related to all of those decisions. In 1950s, epidemiologists reported the increased risk of lung cancer among smokers. So, individual decision to quit smoking is based on this information. In 1970s, epidemiologists documented the role of exercise and proper diet in reducing the risk of heart disease. So, daily individual decision depend on eating of healthy food. Epidemiologists during the mid of 1880 identified an increased risk of HIV infection associated with certain sexual and drug-related behavior. So, get rid of these ungood behaviors or bad behaviors will lower the risk of HIV. Also, epidemiologists from decades denoted to the presence of test and slaughter or SID test for get rid of the tuberculous animals. So every person will have a farm have to decide by law how to make the test and slaughter for its farm to get rid of tuberculous animals. These and hundreds of other epidemiologic findings are directly relevant to the choice of people made every day, choices that affect health of the people themselves, health of the community, health of the society. As we said before, epidemiology look for the whole population as a one patient. The fourth purpose of epidemiology is to estimate effectiveness of health program and services in improving health population. When investigating a disease outbreak, we are rely on health care providers, veterinarians, and laboratories to establish the proper diagnosis of individual animals and patients. Both epidemiologists also contribute to veterinarians and physicians to understanding of the clinical picture and the natural history of this disease. For example, SARS-CoV-2 until last 2 weeks is diagnosed and treated as a respiratory form of a disease. But after make autopsy of 15 persons in Italy, they found that this disease is mostly cause coagulation in blood vessels. So the way of isolation is different for diseased persons, as they now isolated in homes, taking medication in homes. The line of medication is also changed from chloroquine or the others of medication to just paracetamols, antibiotics, and those drugs make high level of immunity. Although the physician, veterinarians couldn't make a definitive diagnosis, they will depend on the epidemiology studies. Within weeks, within days, within months, epidemiology prove it is a part of completing the clinical picture of any disease. Epidemiology also have been instrumental in characterizing many non-acute diseases, such as numerous conditions associated with cigarette smoking, from pulmonary and heart diseases to lip, throat, and lung cancers. So, in human medicine or veterinary medicine, epidemiology needed for completing the clinical picture. Another examples for searching of effectiveness of health programs and services using of antibiotics in case of equine influenza, such as Pamflor, as well as using of vaccination against equine influenza, with eradication of severely diseased cases. This made by veterinarians for improving population health and monitoring also the health science. So, epidemiology usually complete the clinical picture and complete this picture for effectiveness of health programs and services. Epidemiological perspective and usage. Epidemiology is a way of thinking about health of animals and human ecology, causes as stress factors present, all the whole environment, and etc. Epidemiology perspective and usage. The first is determine the origin of a disease whose cause is known. Many diseases with known cause can be diagnosed precisely by the signs exhibited by the affected animals, by appropriate laboratory tests, or by other clinical procedures such as radiological investigation. For instance, the diagnosis of salmonellosis in a group of calves is relatively straightforward. The infection frequently produces distinct clinical signs. However, determining why an outbreak occurs by using the correct procedures to prevent reoccurrence can be difficult. For example, the outbreak may have been caused either by the purchase of infected animal or by contaminated food. Further investigation are required to identify the source of salmonellosis infection. When the food is suspected, the ration may consist of several components. Even if a sample of each component is still available, it would be expensive and possibly uneconomic to submit all of the samples for laboratory examination. Consideration of the risk associated with the consumption of each component of the ration may narrow the field of investigation to only one or two items. There are many examples of the investigation of diseases with known causes that involve answering the questions: why has an outbreak occurred? Or why has the number of cases increased? For instance, an increased number of actinobacillosis group in cattle might be associated with grazing of a particular pasture of burned of stubble, such as occurrence could be associated with an increase in abrasions of their buccal mucosa, which could increase the animal susceptibility to infection with Actinobacillus ligneriaceae. An increased number of cases of bone defect in puppies or lambs might be due to local publicity given to the use of vitamin supplements instead of sun, resulting in the transmission administration to animals that were already fed a balanced diet, with a consequence to hypervitaminosis and osteodystrophy. An increase in the number of lamb carcasses with high ultimate pH value could be associated with excessive washing of the animal prior to slaughter. The possible explanation can be verified only by epidemiological investigation. This is a picture of a cattle showing the classical form of lumpy skin disease. This picture is known for many of veterinarians in Egypt and Africa, where three epidemics are noted in Egypt at first one at 2006 and then the second at 2012, the third at 2018. The cause is lumpy skin disease virus. In addition to, owners of animals didn't vaccinate their animals, so lack of vaccination of some animals will make the propagation of the viruses in them. Also, introduction of animals from African countries without quarantine due to political reasons, or smuggling of animal as an illegal way by marketer from Libya or Sudan will also help in the distribution of lumpy skin disease epidemics in Egypt. So, knowing the cause, isolation of the virus, making sequencing of the virus give us an idea about the origin of the disease, the cause of the disease. So this helps veterinary authority in controlling of this disease. During 2019 and 2020, there is no report officially about lumpy skin disease in Egypt due to proper control of this disease. So epidemiology is a way of thinking and decision maker for the whole countries or for individuals after knowing the cause. This picture showing 3D structure of SARS-CoV-2 virus in a bloodstream of a deceased person. Isolation of the virus and then molecular characterization of it denoted that it line between SARS and Corona. So, knowing the cause give us a promotion for controlling and treating of any disease. Knowing that it is Corona virus-like, make decision for controlling by spacing, using of masks, gloves, and all individual protection ways. Second perspective and usage of epidemiology is the acquisition of information on the ecology and natural history of a disease. An animal that can become infected with an infectious agent such as Mycobacterium jejuni is a host of that agent. Hosts and agents exist in communities that include other organisms, all of which live in a particular environment. The aggregate of all facts relating to animals and plants in their natural history, related communities, and their environments are termed ecosystem. The study of ecosystems is ecology. A comprehensive understanding of the natural history of an infectious agent is possible only when they are studied in the context of their host's ecosystems. Similarly, an improved knowledge of non-infectious diseases can be obtained by studying the ecosystems and the associated physical features with which affected animals are related. The geological structure of an ecosystem, for example, can affect the mineral content of the plant and therefore can be an important factor in occurrence of mineral deficits and deficiencies and excesses in animals. The environment of an ecosystem affects the survival rate of an infectious rate of their hosts. Thus, infection with helminths-like Fasciola hepatica is a serious problem only in poorly drained areas because the parasite spends parts of its life cycle in the snail. Each of 200 antigenic type reservoir of Leptospira interigenosa is maintained in one or more species of a host. Serovars Combingy, for instance, is maintained primarily in rats. Thus, if this serovirus is associated with leptospirosis in either man or domesticated stock, then part of the disease control program must involve an ecological study of the populations and control of infected rats. Similarly, in Africa, a herpes virus that produces infections without signs in wild beasts is responsible for malignant catarrhal fever of cattle. Wild beast populations here must be investigated when attempting to control malignant catarrhal fever in cattle. An ecosystem climate is important because it limits the geographical distribution of infectious agents that are transmitted by arthropods by limiting the distribution of these arthropods. So, infectious diseases that are transmitted by insects, ticks, and other arthropods and which may be maintained in wildlife present complex ecological relation to nearby domesticated farm and even more complex problem relating to their control. Comprehensive epidemiological studies of all diseases help to control and make understanding of the different diseases. Collection of blood samples from cattle during feverish condition also help in detection which disease is for. So this determines the causative agent that may be Babesia, Filaria, Anaplasma, E. coli, Staphylococci, Streptococci, or others. Collection of nasal swabs and blood samples from human for identification of presence of SARS-CoV-2 virus help in detection the origin of the virus, it is from animal or man, and sequencing of this virus will help in the discussion about the origin of the virus. It is from Wuhan or from United States, or it is used for biological weapons between the both countries. This discussion will appear in the future. So this is one important usage of the epidemiology for determination of the origin of any disease whose cause is known. Third perspective and usage of epidemiology is the planning, monitoring, and assessment of a disease control program. The instruction of any program to either control or eradicate a disease in an animal or human population must be based on a knowledge of the amount of the disease in that population, the factors associated with its occurrence, the facilities required by veterinarian or medical services to control the disease, and costs and benefits involved. And information is equally important for mastitis control program on a single dairy herd farm and for national brucellosis eradication scheme. The epidemiological techniques that are employed include the routine collection of data on a disease in a population by means that monitoring and surveillance to decide if the various strategies are being successful. This being clarified during the last pandemic of SARS-CoV-2 as social awareness with protection of different peoples in population help the reduce of rate of infection, as well as usage nowadays of antiviral drugs with paracetamols and antibiotics help in reduction of the disease. So information of surveillance is also required to determine whether occurrence of the disease is being affected by new factors or not. For examples, in animals during the eradication scheme of bovine tuberculosis in New Zealand, Opsismus become infected in certain areas. It is a wild animal. New strategies has to be introduced to control this problem. During foot and mouth disease epidemic in UK, surveillance program indicated the importance of wind-borne virus, particularly in transmission of the disease for about 100 to 150 kilometers. This additional knowledge was relevant to the establishment of areas within which there was a restriction of animal movement, restriction of people movement, restriction of facilities for eradication and control of any disease. This is a picture of mortalities in America and Europe during influenza pandemic at 1918 and 1919. So, studying this shape give us an idea and knowledge about the disease of SARS-CoV-2 is different than the influenza, and then the planning of another control program have to be done. So knowledge about the disease and the ecology as well as the monitoring of the control program is one of the prospective causes of epidemiology. This picture make interpretation and differentiation between a field hospital during influenza pandemic at 1918 in USA and the lower instrument health care in these field hospitals. This leads to 50 million deaths during that time. A field hospital during SARS-CoV-2 pandemic at April 2020 in Italy, which is the highest rate of deaths in Europe, reached only to about 30,000 during this day, the 7th of May 2020. So, if we compare between 50 million of deaths during the influenza pandemic in the United States at 1918 and 30,000 of people dead in April in 2020 in Italy during the SARS-CoV-2 pandemic, it is nothing. Knowing of the cause, knowing and monitoring the control programs is one of the perspective of epidemiology. The fourth perspective and uses of epidemiology is the assessment of the economic effect of any disease and analysis of the costs and economic benefits of alternative control programs. The cost of the control of a disease in a livestock industry or between human population must be balanced against the economic losses attributed to this disease. Economic analysis is therefore required. This is an essential part of modern planned animal health programs and human medical health programs. Although it may be economically to reduce a high level of a disease in a herd or flock, but it may be uneconomic to reduce even further the level of the disease that is present at only a very low level. If 15% of cows in a herd were affected by mastitis, productivity would be severely affected and a control program would be likely to reap financial benefits. On the other hand, if less than 1% of the herd were affected, the cost of further reduction of the disease might be not result in sufficient increase in productivity to pay for the control programs. Also, the closure of different restaurants, cafes, and plants during the pandemic of SARS-CoV-2 caused the economic huge number of trillions of euros, dollars, and the national currency of different countries. So, after reduction and after reach to the peak of the disease of this pandemic in every country, economical reopening of every part of life is begun. So control programs cost economic. So it must be evaluated and estimated every time. Introduction of the uses of epidemiology indicates that the subject is relevant to many areas of human medical science or veterinary science. The general agriculture practitioner is becoming increasingly concerned with herd health. The combination animal practitioner is faced with chronic refractory disease. Also, the combination between human population and animal population occurred during flu avian influenza or during the SARS and MERS due to transmission of these diseases from animals to human. So the authorities of veterinarian and authorities of human health service cannot perform the routine duties without reference to the disease in the national animal population and in the national human population. The diagnostic pathologist investigates the association between cases and effect by mean lesions. This approach is epidemiological when interference are made from groups or animals. Veterinarians in abattoirs and meat processing plants attempt to reduce the occurrence of defects and contamination by identifying and eliminating their causes such as tuberculosis. Similarly, industrial veterinarians concerned with the design of field trial compare disease rates and response to treatment in various groups of animals, as known as drug trials. So, estimation of the economic effect of control programs will be a great step in every country to decide. So, as we said before, epidemiology is a way of and daily thinking. This is a clear example for the estimation of control program of a disease. The progressive control pathway for foot and mouth disease definitions and the criteria for progress. 5 stages that progressively increases the level of foot and mouth disease control developed by FAO and European Foot and Mouth Disease Organization, intended to assist foot and mouth disease endemic countries to progressively reduce the impact and burden of foot and mouth disease, as closure and embargo done by other European and other world countries against the animals come from Europe, UK during the post-pandemic at 2001 and 2006 make them costly economic dropped. So this disease control program for foot and mouth disease is an important to control the disease without looking for how much they pay, as they will gain millions of euros from selling of animals after control of this disease. This is an example for control programs and estimation of it. In this schedule, we will find questions and answers, and we will give examples by dairy farm have mastitis with more than 30%. Define the scope of the analysis. What are the objective and the limitation of the program? The objective is to reach by mastitis to about 1%. The limitation of the program, we didn't have the trainer and trainee workers that help in complete this program. Identified program inputs. What is the range of resources used in the program? Is the economics of the farm. Monty's program inputs. What are the financial costs associated with the use of these resources? Financial cost is about $200 by about 120 and 200 of Egyptian currency. Identify program effect. This program effect will raise the productivity of the farm by about 29 to 30%. Obtain estimate program effect. How do the treatment and the control groups compare before and after program? After application of this program of control of mastitis, the productivity of this farm increased by about 25%. Compare program inputs and program effects. What does it cost per effect? It cost about 300 Egyptian currency. Identify social benefits. What is the range of social benefit derived from this program? Continuity of the farm in production of more milk for the neighboring population. Compare social benefits of the program effect against program input. What is the ratio of benefit of costs? Ratio of benefit of costs is about 85%. So this is the usage of control program estimation and analyzing of the epidemiology data for each control program, not only for mastitis but also for every disease occur in a population. This diagram showing the difference in costs and difference in effects with intervention dominated cost effectiveness ratio. Cost effectiveness ratio and intervention dominates. So we can by this diagram analysis the cost and benefits of any control programs for any human population or animal population. Another example is the evaluation of clinical and economic consequences. Antimicrobial stewardship program implemented in outpatient dialysis facilities. Cost consequence of analysis and to analyze clinical and economical consequences and of an antimicrobial stewardship program of dialysis facilities. The antimicrobial steward program suspected infection animal treated especially and the appropriate. This nation level all over the United States results 4.8% fewer infections by multi-drug resistant organisms and C. difficile or Corynebacterium difficile. The 4.8% fewer infectious related deaths. This cost savings about $106 billion almost per year by means at 5% of reduction. So economic assessment of the control program is very important for both veterinarians and human health services. The fifth perspective and usage of epidemiology is the investigation and control to any disease whose cause is either unknown or poorly understood. There are many historical instances of a disease control based on epidemiological observation before a cause was identified. Examples include contagious bovine pleuropneumonia in Egypt and United States. The cause of squamous cell carcinoma of the eye in Hereford cattle cancer eye is not known. Epidemiological studies have shown that animals with unpigmented eyelids are much more likely to develop the condition than those with pigmented. The information can be utilized by cattle breeders to select animals with low susceptibility to this problem. Also, in eradication of rinderpests globally, rinderpest present mainly in Africa and some parts of Asia like India and China, but global eradication of the disease from these parts and other parts become unexpected to face the problem in the others free area where during 14 of October 2010 FAO organization that belonged to United Nations announced eradication of rinderpest globally, and this formal declared at June of 2011. So the whole world get rid of rinderpest unless this disease not known in certain areas of the world. So eradication program of unknown cause or known cause is the key of increasing economic of the world. Series of epidemiology to be continued. So please subscribe the channel to contact with the most modern knowledge about epidemiology.